Welcome to the Deep Dive. I'm your host, and we are so glad you're here with us today.
And I am the resident expert for today's topic. Really excited to get into this one.
Yeah, me too. So I want you to start by picturing a scenario for a second. Imagine you, or maybe a loved one, are navigating a highly complex health issue.
Right.
You have access to the absolute world's best doctors. You're in a facility with state-of-the-art medical technology. You receive this brilliant, life-saving treatment plan that is just perfectly coordinated by a top-tier medical team.
Which takes millions of dollars in research and infrastructure just to get to that point, by the way.
Exactly. Millions of dollars. But then that entire chain of care completely falls apart simply because the patient couldn't get a ride home.
It sounds absurd when you frame it that way, but it is a silent crisis happening every single day in clinics and hospitals across the country. We build these massive, technologically advanced medical centers, but we completely neglect the physical mechanism of actually getting vulnerable people through the front door.
And that is the core theme we are exploring today. Why healthcare access quietly breaks down at the logistical level, and how a unique local fundraiser is stepping up to help fix it.
Yeah.
To guide us, we're looking at some fascinating materials, including a series of incredibly insightful YouTube videos from SwiftAid Transport. These feature insights from its founder, Jamel Holder. We are also looking through the campaign materials for an upcoming community event called Driving Dignity Forward.
And our mission for this deep dive is to really uncover this hidden logistical blind spot in our healthcare system, specifically medical transportation. We're going to explore why relying on convenient consumer apps is actually a massive legal and physical liability.
Oh yeah, the consumer app part is wild.
It really is. And then we'll look at how a community-driven initiative is building a practical, dignified solution right from the ground up.
Okay, let's unpack this, because when we talk about a logistical blind spot, it can sound a bit abstract, like maybe just a minor scheduling hiccup.
A little delay, yeah.
Right. But the materials we reviewed paint a vivid and, frankly, heartbreaking human reality. This isn't just about spreadsheets, it's about real people right in your own community. We're talking about seniors sitting, tired and forgotten, in wheelchairs for hours after their appointments have ended.
Just staring at the clinic doors, waiting for a ride that might never come.
Exactly. And the physical toll of that waiting is profound. Jamel Holder's videos highlight dialysis patients in particular.
Yeah, that part really stuck with me. Because these are people whose very lives depend on strict, consistent treatment schedules. When they have their care interrupted because of inconsistent rides, it isn't just an inconvenience.
No.
It is a direct threat to their immediate survival.
And picture the families, too. You have relatives who are frantically scrambling to figure out logistics after a hospital discharge. They should be focused on recovery, right? Reading over new medication schedules, comforting their loved one.
But
Instead, they are desperately trying to find a vehicle that can safely transport someone who might be in a cast or heavily medicated or physically weakened.
And then you have the healthcare workers themselves. The social workers, nurses, discharge planners, they are stuck making frantic last-minute phone calls, basically playing amateur dispatcher instead of focusing on patient care.
You might be thinking, I didn't realize this was happening in our own community. But it is, every single day.
And to understand why this keeps happening, we have to recognize that this is a systems gap, not an individual failure.
Right, because usually the patient gets blamed?
Exactly. If a patient misses an appointment because they don't have a ride, the medical establishment tends to label that patient as non-compliant. But it is a fundamental breakdown in the chain of care. If we connect this to the bigger picture, this hidden barrier directly affects 5 critical areas of healthcare.
I'd really love to go through those 5 areas because understanding them completely shifted my perspective on what transportation actually means in a medical context. Let's start with readmission rates.
Okay, so readmission is the metric that keeps hospital administrators awake at night. A missed ride doesn't just mean a missed appointment. It means a missed follow-up.
Right.
So a chronic condition that was totally manageable on Tuesday suddenly worsens by Friday simply because the doctor couldn't check on it. That leads directly to a preventable, highly expensive emergency room visit over the weekend. The ride itself might cost $40, but the resulting ER visit costs thousands.
Which bleeds right into the second area, continuity of care. The period right after a hospital discharge is incredibly fragile.
Highly vulnerable time.
Yeah. Patients are dealing with new medications, dietary restrictions, wound care instructions. That transition requires a seamless handoff between the hospital, the outpatient clinic, and the home. Transportation is the literal physical link in that continuity. If the link breaks, the whole chain shatters.
Then there is the third area, which is perhaps the most profound on a human level.
Yeah.
Patient dignity.
Yes.
When you leave someone waiting in a public lobby for 4 hours after a deeply personal or invasive procedure, you are stripping them of their basic respect. It transforms a healing environment into a deeply anxiety-inducing one.
They feel like a burden.
Exactly. And that emotional state actively works against their physical recovery.
And that anxiety ripples out, affecting the fourth area, which is facility efficiency. Delays create total workflow nightmares for the staff. If a patient can't leave because their ride hasn't shown up, that bed cannot be given to the next person who desperately needs it.
So you have highly skilled, highly paid medical staff standing around managing logistics and traffic control.
Right. And finally, the fifth area is care equity. Those without reliable transport, which is often the most vulnerable populations like the elderly, those with disabilities or lower income families, they are systematically denied the care they need.
It creates a deeply unfair two-tiered system of health outcomes based entirely on mobility. If you own a car, you get better health care. It really is that stark.
Hearing all of this, the modern brain immediately jumps to what seems like the obvious, easy fix. It is super tempting for facility managers to just default to the gig economy, to clear out waiting rooms, just booking a quick Uber or Lyft.
It seems like a quick fix.
We use consumer apps to deliver our groceries and take us to the airport, so blending gig work with healthcare logistics seems like a no-brainer on the surface.
It might seem like a no-brainer, but treating medical transportation like a trip to the mall is creating massive legal and physical liabilities. When you start mixing healthcare with the gig economy, the illusion of convenience shatters very quickly.
I was actually reading about how these medical rides even end up on consumer apps in the first place, and it mentioned something called a broker system. How does that actually work, and why is it legal if drivers aren't medically trained?
Okay, so the broker system is this quiet, highly profitable middleman setup.
Yeah.
A hospital or insurance company might pay a high rate, say $150, for a proper medical transport.
Okay.
But a broker company intercepts that contract. They quietly outsource the ride to a consumer gig app, pay the driver the standard fare of maybe $10, and pocket the massive difference as profit.
Wait, so the driver hits accept on their phone, having absolutely no idea they are taking on a medical transport?
They have no idea. They were just doing it for standard fare. They might make only $4 to $15 for the ride. Jamel's videos even mention drivers being sent on trips up to 200 miles long into rural areas with absolutely no chance of getting a paying passenger for the ride back.
Wow.
The asymmetry of risk versus reward is staggering. A driver is making pennies, but they are suddenly shouldering massive liability.
I really want to talk about that liability, particularly regarding patient privacy.
Yeah.
Because the materials brought up HIPAA implications, which frankly hadn't crossed my mind at all. What happens if a gig driver inadvertently sees a patient's medical information?
It is a legal minefield. Standard rideshare insurance is designed to get someone from point A to point B. It does not cover medical assistance. If a fragile patient falls while trying to get into a standard sedan, the driver is in a huge insurance bind.
Right.
Furthermore, if a driver sees a discharge paper sitting on the back seat or overhears a phone call about a diagnosis, they are suddenly entangled in federal patient privacy laws. Standard auto insurance will not protect a driver from a HIPAA violation lawsuit.
That puts the driver in an impossible position, and the danger for the patient is even worse. There is this harrowing anecdote Jamel shared that I think highlights the dark absurdity of this system. Imagine a patient who is in a wheelchair, recovering from surgery, with a full leg cast that sticks straight out.
Oh, this story is wild.
It is. They're waiting for a ride, and 3 different standard sedans show up. 3, because the automated algorithmic system just kept sending the wrong tool for the job. You kind of have to laugh at the bleakness of expecting a Honda Civic to magically transform into an ambulance just because an app commanded it to.
Yeah.
The driver pulls up, sees the wheelchair and the cast, realizes they can't physically fit the patient in their car, and cancels.
We have to remember that gig drivers have 0 required medical training. They do not have CPR certification, they have no first aid requirements, and they have absolutely no professional obligation to help a patient physically navigate from the clinic doors to the vehicle. They are there to drive, nothing more. We are trying to use a consumer tech app to solve a highly specialized medical logistics problem.
So if consumer apps are a dangerous mirage, what is the actual alternative? Jamel's organization operates in a space called NEMT. Can you explain what that is and how it differs from just calling a cab?
NEMT stands for Non-Emergency Medical Transportation. True NEMT is not an app. It is a dedicated professional extension of healthcare. It is built from the ground up to solve the exact problems we just outlined. To safely integrate transportation into healthcare, facilities must use a rigorous six-step vetting framework to ensure their providers are legitimate.
I'd love for you to break down that six-step framework because it really highlights the massive gulf between a professional service and a gig driver.
Absolutely. The first step in this compliance-first model is strict adherence to state licenses and Americans with Disabilities Act, or ADA, regulations. This means the service is legally recognized as a medical entity, not a taxi service.
Which brings a completely different level of oversight. It isn't just a tech company operating in a legal gray area. It is a regulated healthcare partner. What is the second step?
Insurance. We aren't talking about a personal auto policy with a rideshare add-on. A true NEMT provider carries non-negotiable commercial auto liability, general liability, and workers' compensation. This is the financial safety net that protects the facility, the staff, the driver, and the patient if anything goes wrong.
That leads directly to the third step, which focuses on the people behind the wheel. A standard driver's license just isn't enough here.
Far from it. Step 3 requires trained drivers. These are professionals certified in CPR, first aid, and specific mobility assistance protocols. They know how to properly secure a wheelchair using 4-point tie-downs. They know how to safely assist someone who is a severe fall risk without injuring the patient or themselves.
Which is a stark contrast to a gig driver who might not even get out of the car to open the door. And I imagine step 4 deals with the cars themselves.
Yes, the vehicles. They must be clean, well-maintained, and crucially wheelchair accessible. But it goes beyond just having a ramp. They are backed by strict daily inspection logs that a healthcare facility can actually review to ensure ongoing compliance.
Step 5 addresses the workflow chaos we mentioned earlier regarding facility efficiency. How does NEMT solve the issue of nurses playing dispatcher?
Through professional communication, a vetted NMT partner establishes clear escalation paths. If there's a delay, the facility knows exactly who to call. They provide actual, reliable pickup windows based on dispatch reality, not vague algorithmic guesses that change every 3 minutes.
And the final step ties it all together to prove they're actually doing what they promise.
Right. Step 6 is accountability. A proper provider uses verifiable data and performance metrics, like on-time percentages and incident reports, to prove their reliability to the hospital administrators over time.
When you lay out those 6 steps, it is a completely different universe from calling a rideshare. And understanding this rigorous framework explains a major shift happening in the medical field right now regarding how hospitals view transportation. It ties into something called value-based care.
Yeah, in the old model of healthcare, hospitals were paid via a fee-for-service model. They got paid for every procedure they performed, whether the patient actually got healthier or not. But in a value-based care model, hospitals are financially rewarded for keeping patients healthy and penalized if patients are readmitted for the same issue. The focus shifts entirely to the quality of the outcome.
So in this new value-based world, funding a simple ride to a follow-up appointment is no longer viewed as a nice customer service perk. It is a direct strategic clinical investment. It is the cheapest, most effective way to prevent a massively expensive hospital readmission down the line. You spend a little on logistics to save a fortune on emergency care.
Understanding this massive systemic problem is vital, but looking at a local, on-the-ground solution is where we start to see real hope. And that brings us to SwiftAid Transport.
Here's where it gets really interesting. SwiftAid Transport is an organization founded by Jamel Holder, who operates with the pronouns she and her. Her approach is fascinating because she didn't just decide to start a driving service. She looked at this massive systemic gap leaving vulnerable people stranded and built an organization with a profound compliance-first mindset. She explicitly designed SwiftAid to ensure no one in her community is left waiting for care.
And right now, SwiftAid is facing a very specific, tangible financial hurdle to get fully operational. They have done the grueling administrative work. They are fully registered. They are compliant with all those 6 steps we discussed, and they're already pre-approved for a $120,000 startup loan.
That's huge.
It is. But, as is common with commercial lending, the bank requires them to show $14,500 in liquid capital. It's a requirement to prove they have skin in the game before the larger funds are released.
And the psychology of this donor appeal is incredibly compelling. Because of that loan structure, this isn't a situation where a dollar raised just buys a dollar's worth of service. Every single dollar raised by the community to help them reach that $14,500 goal essentially unlocks 10 times its value. It is an incredibly high leverage opportunity for community investment.
When donors feel like they're providing the key to unlock a much larger vault of resources, the contribution feels like a strategic investment rather than a simple charitable handout. It empowers the community to build a piece of infrastructure.
And the campaign is crystal clear about what that infrastructure looks like. If the community rallies to hit this goal, those funds support four specific pillars. First is vehicle readiness. This goes directly toward purchasing their first fully AD-compliant wheelchair-accessible vehicles. Second is safety and compliance systems, covering those massive commercial insurance policies and state certifications.
The third pillar is driver training. This ensures the staff are fully certified professionals, capable of treating patients with the dignity we discussed earlier. And the fourth pillar is operational infrastructure. It takes significant capital to implement technology-enabled dispatch, real-time GPS tracking, and automated scheduling systems. These are the tools that remove the anxiety of waiting for both families and medical facilities.
Which brings us to the actual community event that is going to make this launch possible. It is called Driving Dignity Forward. Looking closely at the campaign materials, there is a brilliant and crucial language shift. They are not making a traditional plea that says, please support our business. The messaging is framed as an invitation. Join the effort to strengthen access to care.
By shifting that language, Jamel Holder is reframing the entire nature of the event. It's positioned as a leadership moment. It is a partnership opportunity. She is creating a shared community solution space.
It acknowledges that this isn't just SwiftAid's problem to solve. Transportation gaps affect the entire community's health infrastructure, so it brings everyone to the table. They are gathering healthcare professionals, hospital administrators, social workers, municipal leaders, and local business owners all in one room.
And the choice of venue reinforces that community-first mentality. Hosting the event at the Salvation Army in Middletown is a powerful statement. It strips away the corporate veneer you might find at a hotel ballroom and underscores that this initiative is deeply rooted in serving the most vulnerable populations among us. It really grounds the mission in human impact.
For those attending, the evening is designed to be highly engaging. It's a rare opportunity for professional networking across different industries, connecting clinical healthcare workers with local government officials and business leaders who might not usually cross paths. There will be a guest speaker breaking down the broader landscape of healthcare access in the region. Plus, they are creating a welcoming atmosphere to foster these connections, featuring live music and light refreshments. It's about building relationships while solving a critical local problem.
Because when you attend an event like this or support this kind of initiative, you aren't just funding a van. You are funding the bridge that connects the clinical care a patient receives to the community where they actually live and heal.
We want to make sure you have the exact details if you want to step into this solution space. The Driving Dignity Forward event is taking place exactly a month from today. So mark your calendars for Saturday, April 11th, 2026.
The event begins at 4 p.m.
The location is the Salvation Army, Middletown. That address is 80 West Main Street, Middletown, New York, 10940. If you want to get involved or if you have questions about sponsorships, attendance, or the mission itself, you can reach out directly to Jamel Holder, the founder and owner of SwiftAid Transport. Her phone number is 347-683-2170, or you can email her at jamel.holder@swiftaidtransport.com.
As we wrap up this analysis, all the data on readmission rates, the logistics of the broker system, and the deeply personal stories of patients waiting in lobbies distill down to one incredibly clean, powerful thesis.
Access to care begins with a ride. It is that simple and it is that profound. Without the ride, the rest of the healthcare system simply cannot function.
And I want to leave you with one final thought to mull over as you go about your day. We've spent this time dissecting how specialized transportation is critical to individual health outcomes and facility efficiency. But if we truly accept that moving vulnerable people safely is a foundational requirement of healthcare, how should that realization change the way we approach urban planning and zoning laws for our neighborhoods in the future? If a community isn't built to accommodate the vehicles that keep its residents alive, is it really a healthy community at all?
Wow, that completely changes how you look at the design of the streets right outside your window. Thank you so much for joining us on this deep dive. We hope you walk away with a new perspective on how our communities stay healthy and the invisible systems that keep it all moving. Until next time, keep asking the big questions.